Hello guys, my name is Lindsay Federico, and me and Elizabeth Nolan are doing the disease Trichomoniasis, and this is going to be the overview for that disease. Trichomoniasis is a common transmitted infection. It's caused by a parasite, and it could spread through genital touching and sex without a condom. Trichomoniasis can affect men and women. In women, trichomoniasis can cause a foul-smelling vagina discharge, itching, and painful urination. Men don't really get symptoms, but if they do, there's a burning sensation, itching, and urethral discharge, which is a clear pus that comes from the penis. Hello, so this is the signs and symptoms of trichomoniasis. Some people could get symptoms and some people may not have any symptoms at all. But if you do get symptoms, it usually appears within 5 to 28 days after you've been exposed to it. Women's symptoms include itching near the vaginal area, swelling, and a foul discharge coming from your vagina. And you get a frequent urge to urinate. And when you urinate, it's painful and it burns. Within men, though, a lot of men don't get symptoms, but if they do, it's kind of the same thing. With men, there is obviously a discharge coming from their penis, and they get also a frequent urge to urinate, and when they urinate, they get a burning, painful sensation. Also with men, the infection in men primarily affects the urethra, which is the tube that carries urine and semen out of men's body. Hello guys, so today we're going to be talking about the diagnosis of trichomoniasis. One of the first diagnosis tests you could take is you could take a cotton ball swab to collect a sample of fluid from your vagina or penis, and that fluid is checked under a microscope to see if you could see the parasite. And if you could see the parasite within the microscope, then there's no other tests that are needed to take. But if they don't see a parasite, then there's also the culture test, which is sometimes needed if you can't see the parasite in the cotton ball swab. And once you check it with the culture test, it's pretty much a genetic test, but on your cotton swab fluid. Hello guys, so today we're going to be talking about the pathology of trichomoniasis. Trichomoniasis is a commonly sexually transmitted disease which is caused by a parasite named Trichomoniasis vaginalis. They are about the same size as white blood cells, which are 10 to 20 micrometers long and 2 to 14 micrometers wide. Trichomoniasis has about 4 flagellas that are in the organism's anterior, and then they have one flagella that extends backwards over the middle of the organism. Anyone that's sexually active can get this disease. It affects more so women than men, and it also affects more so older women than younger women.
In terms of treatment, after diagnosed, a 7-day course of 500 milligrams metronidazole twice daily is prescribed. Prevention would include using condoms, male or female, clear communication with sexual partners, and regular testing and trips to the doctor, and follow treatment guidelines. This STI occurs most commonly when a person has more than one sexual partners who also have infections. It's also found in 0.5% of males and 1.8% of females based on a study with 4,507 participants. Estimated infection rate is 3.2% higher than those of gonorrhea and chlamydia combined. It's most prevalent in women 40 to 49 years of age in comparison to chlamydia, which is most common in ages 19 to 24. The cure rate after being treated with metronidazole is about 90 to 95%. It's also higher when the sexual partner is also treated. However, reinfection is common in sexually active individuals. It's strongly associated with the presence of other STIs, including chlamydia, HIV, HPV, herpes, and gonorrhea. This STI is also severely affect pregnant women and can put them at risk for premature birth, low weight infants, and premature rupture of membranes. So for the background of our experiment that we chose, it was conducted because T. vaginalis is most times missed by the common wet mount microscopy, which is the most common method used for STI testing in clinics. The methods that they used were first collection of vaginal secretions, then they did the wet mount microscopy, inoculation of cure media. They used 6 different cultures of media, aerobic incubation at 35 degrees Celsius, daily microscopic examinations of cultures. They binded the readings of culture tubes, compared media performance, and then technician performance assessment was conducted, and then finally a volume comparison experiment. So for the results of the experiment, it was found that the diamond medium and modified diamond medium were by far the most sensitive, detecting 97% and 90% of infection, and the lash medium was the worst. This proves that classic wet mount tests primarily used in clinics only caught about 2/3 of infections. For our discussion, we want to talk about why was yeast contamination equal in all 5 of the medias, and what were the percentages of contamination with yeast, and how can this affect us? One question that we have for you guys is, do you think that there should be more of a push to come up with a more accurate way of STI testing, considering that the most common wet mount way of finding infection is really not that great?